quite good because, as you can see here, I'm going to drop it. Here, there's different settings. So you can have it on a low steam setting or a higher steam setting. And that's quite good because it means if your baby finds it, because it does make a bit of noise, to be honest, it's like a little bubbling noise. Now, mine always seem to like it. They kind of, I think it's white noise, that kind of effect. It's just really calming. And I've overall found the product really comforting, especially on winter nights when cough and cold seem to be most dramatic, because basically it's warming. It does release warmness, so it will warm up the room. So you do need to kind of clothe your child according to that. But you can turn it on a low setting when you're getting them to sleep, and then you can always ramp it up a bit for a few hours before you go to bed yourself, and then you can turn it back down low if you want during the night. So that's that. Obviously, you can add a little bit of Vic. Sorry, I forgot to mention, with this, it comes with a little vapor pad, which just slots in here. So you just pop a little pad into this section, and that releases Vic around the room, I suppose the traditional eucalyptus and menthol. That's good, but it's only suitable for children over 3. So for younger children, and actually, you know, anyone, even if you just have a bottle at home and you don't have a Vic pad, that's fine. But you can actually add a few drops of olive oil into this little well. Don't make the mistake I did with my first one and put it into the drum itself with the water, because it can affect the element on the older model. So it goes into this little well, and then the steam comes up through the chimney and lifts the vapor into the room. It's really good for nasal congestion. So that's obviously just a bit about chesty coughs and obviously getting to the root of the problem. So a dry cough can also be alleviated by steam. It basically, dust, pollen, infection, any of these things can cause a dry, irritating cough. And that's a cough where there's no mucus. So it's literally just a sharp barking noise, and it can be very sore. In fact, that's when you tend to get your sore throat and stuff as well. So for that kind of cough, it's really honey and lemon, making sure your baby or child is drinking plenty of fluids. There's lots of different hydration sachets you can get as well, but even just water is fine. Just get them sipping on water as much as they can during the day. There's, again, the family throat syrup, which is suitable from 4 months, is really good. And saline sprays just to keep the sinuses clear, to make sure that no mucus develops and thickens. Because when the airways are dry, when the radiators and everything are on, like at this time of year, the mucus can thicken a bit, and that kind of increases the risk of infection. A barking cough is a cough which is, you know, I suppose, a step up from a regular dry cough. And it's a sign of inflammation in the airways. So it means that the airways are actually getting constricted. An example of this kind of cough is croup. I'll talk more about croup in a minute, but basically that's kind of identifiable as it tends to get worse at night. Again, I know I'm talking about the humidifier, but that helps. Any kind of airway problem, I'm going to be talking about the humidifier. You can just take it for granted, because conditioning the airways, keeping them moist, stopping the airways from drying out, and stopping mucus from thickening is the best way of preventing infection and opening the airways and alleviating the symptoms. So basically, if your child is having a very bad coughing fit at night, which often happens in kind of barking, croupy coughs, the best thing to do if they're in a warm house, I know it sounds strange, but swaddle them up in a blanket and bring them outside into the cold, fresh air. The shock of the cold air on their airways can actually be enough to just stop that little spasmodic section of coughing, and hopefully get them back on the right track for the night. But that kind of cough can be very distressing for children. They get very upset, and really distraction is key. So even bring them around the house in your arms, showing them the pictures on the walls. Bring them into the bathroom, you know, and turn on, if you don't have a steamer, turn on the shower and let the steam build up, and read books. Do whatever you can to distract them and take their mind off it, and just lots of hopes and reassurance. I suppose the next symptom of cough, and general kind of cough, would be wheezing. So with wheezing, it's really generally time to go to the doctor. So often asthma and bronchiolitis are culprits here. Wheezing is when you literally hearing your child breathe in and out like that. It just means that they're struggling to get enough oxygen, and it could be due to, inflammation, etc. So it's always important to get that checked out. A whooping cough, which is basically the noise of a whooping cough, is if your baby is taking large breaths in because they're not getting enough air, and then they're forcing that air out so that they can get another breath in as soon as they can. That's what causes the whooping sound, and that's caused by a bacterial infection, pertussis. You always need to see the doctor about that. So if you hear that kind of symptom where your baby is literally taking huge deep breaths, and after a big forced breath out, just do contact the doctor. Obviously, I suppose good to say here that anytime you see any of the following symptoms, you should see the doctor if it's a cough. So you might think your child just has a cough and cold, and you mightn't want to bother the doctor, and you might think, you know what, I'll just leave it. But if your child has any kind of irregular breathing, their pattern becomes unrhythmical, it's not normal, not following a normal rhythm, well, it's really important then to get them checked out. If they have any difficulty breathing or a wheeze, as I mentioned, and also if you have a baby who's under 3 months, which a few of you tonight do, if they're coughing consistently for more than a few hours, do just get them checked out. They're at such a vulnerable age, and it's important that their oxygen levels remain high and they don't get too distressed. If your child gets any sort of blue tone to their lips or their face, this kind of area, obviously get them checked. And if they have an exceptionally high temperature, to know that you can't get down with Calpol and Nurofen, or any kind of paracetamol basically, or ibuprofen, then you need to get it checked. If your child, I have a blog on dehydration, which is one of the ones that actually in the personal messages that I get on Facebook, nearly every time I end up sending at this time of year the blog on dehydration, because with any of these conditions, fluid intake can be affected. Whether you're breastfeeding, bottle feeding, anything, it can be hard to know if your baby's getting enough fluids. And what's enough for one isn't necessarily, right for another. So, and it depends on how much they're eating, because obviously if they're weaned, there's fluid in food. So it all adds up, but you really need to know what to be looking out for. So I'd really recommend, even I suppose sometimes when I'm looking for my own articles, to be honest, the easiest way to do it is just go into and do a Google search and just Google WonderBaba dehydration. It just pops up then, and then you find it. So I tend to do that for any any situation. I'm never looking for my own blog to print to give people. Just type, Google search WonderBaba and then your topic. I've written over 150 articles, so hopefully you'll find something. Julie is just pointing here. Give me 1 second. Perfect. Yeah. So Julie is popping little notes up into the chat that you'll be able to see. So she's popped the link up to the dehydration blog there. I definitely feel that that's one of the most important articles that I've written, and I do reference it in every single topic that comes up. The next, I suppose, type of cough that I want to focus a bit more on is bronchiolitis, and really that's because of the time of year. Bronchiolitis, unfortunately, is just rampant, and it's sadly one of those conditions that actually affects children under 1 most. By 50% of children will have had bronchiolitis by the age of 2, which I find a shocking statistic, because you kind of think it's one of those conditions that just won't happen in your house. But then all of a sudden, you hear of your neighbour or your friend who ended up in a big hospital stay with a very sick child, and bronchiolitis was the culprit. It can be quite a scary condition. So it's caused by a virus known as RSV, which is respiratory syncytial virus. Well, that's the most common cause of it. It basically is inflammation of the little bronchioles, which are the little airways that sit in your lungs. And they're responsible for the oxygen uptake by your blood. So when they're inflamed, obviously that oxygen just isn't transferring properly, and there's a lot of irritation, and it's very hard for your child to breathe. So, between November and March now is prime time for bronchiolitis. So it's just important to watch out for it. All these kind of infections, obviously, these ones are viral. So the best thing to do is to make sure that your children are doing the whole cough into the elbow, catch it, I always get this wrong, catch it, kill it, thin it. Yeah, so with their tissues, use that phrase. It's a HSE phrase, and it's like, it's a good one to teach them. So tell them to, if they're sneezing, sneeze into a tissue, so you're catching it and then dump it basically, and using your antibacterial hand gel if you can, and just getting your child to wash their hands frequently and washing the toys regularly if there's bronchiolitis in the house is really important. The treatment for bronchiolitis really is limited because it's viral. So generally things like keeping your baby upright while you're feeding them, checking on them during the night. It's one of the only conditions that I actually say do, get out of your bed, set your alarm and check that your baby is breathing okay. For most cases, I say once they're asleep, that's great. But bronchiolitis is one of the ones where you do kind of need to be a bit more vigilant. Keep them really well hydrated, keep smokers away. Again, products like the Vic adding humidity are really good for these acute cases of respiratory problems. So again, the same thing, bring them to the doctor. If you have any doubt of dehydration, So obviously that link will be in the chat for you for that blog. It's definitely one to save. So if they've any difficulty breathing, or if they're pale, sweating and having long pauses between their breaths, then that would actually be a situation where you'd be ringing 112, your emergency services. Just, yeah, as I said, keep the surfaces clean and keep newborn babies away from people suffering from colds and flu if possible. Like, mostly it's not possible because it's one of your other infected children who is loitering in the kitchen right beside your new baby. So there's not really a lot you can do about that. So, yeah, just to do what you can, I suppose. Croup is the condition I mentioned earlier. So that's a really frightening one. As I said, keeping them distracted during spasmodic coughing episodes. It's a really barking cough, and it's a cough they cannot control. They're coughing so much they could even vomit. They're coughing so much they can't breathe. They're crying, they're upset, do not know what's wrong with them. And that's the situation in the middle of the night where you're swaddling them up in the blanket and bringing them outside, trying to shock their lungs into reduced inflammation so that they can get some, respite from the breathing problem. It is unfortunately a condition that affects boys more than girls, and it's usually in children from 6 months to 3 years of age, but actually can affect children right up to 15 years of age. Obviously, you do hear a whistling noise with croup. So there's a big cough, and then as they take a breath in, they make a whistling noise, and that noise is called stridor. So basically, it's always, you get your whistling noise in, so your stridor in, and a barking cough out. So that's kind of how you know it's croup that's affecting your child's airways. So generally it'll start off as a cold. So unfortunately, a lot of these conditions will start off with the upper nasal symptoms and just general like mucus problems. So keeping the mucus under control, that's, is important. And that's why I always say as soon as a cold comes, get the Vic humidifier on in the bedroom, because keeping that mucus thin reduces the chance of developing into any of these other respiratory conditions.